Afternoon, everyone. Welcome to another South Fulton Mental Health Collaborative Wellness Wednesday series. Today, we have two special guests for you all for our series today. And so, Elise and I, we will definitely introduce our special guest. But first, I want to tell you about our topic for today. So, our topic is trauma, mental health, and equity, a roadmap for the future. This is a topic that we have found to be so very important to the parents and to the community. And we would like to also give a special thank you to Fulton County Schools and the South Fulton Parent Collaborative for really wanting to start the collaborative for South Fulton parents and the community. So again, I am Tedra Perkins. I am Child and Adolescent Coordinator for Odyssey Family Counseling Center. And we have our Executive Director, Charles Relaford, here with us as well. Hi, Charles.
Good afternoon. How are you?
We're good. Thank you so much for joining us.
Absolutely. I would not miss this opportunity to be with Dr. Harris.
Yes, yes. And also, again, we have Elise Payne.
Hi guys, it's Elise back again. I am the school-based program coordinator here at Odyssey Family Counseling Center. So I have the pleasure of working closely and collaborating with our schools and our school communities. And so this, just like Tedra said, this collaborative is a partnership with you out in our communities, and we welcome you today. Just as a reminder, please feel free to comment or write questions in the chat for us. I'll be monitoring that throughout today so that, we have an amazing person. I'm going to get to introduce here Dr. Harris in just a moment. So please, utilize this resource. This is something that you guys have asked for having this kind of format for people to come and speak and share some information with you. So please take the advantage of this opportunity to ask your questions, and we'll make sure to give those to Dr. Harris so that she can share more of her expertise with us. So without further ado, I'm going to go ahead and introduce our esteemed guest today. Welcome, Dr. Harris. This is Dr. Patrice Harris. She is a psychiatrist here in Atlanta and is the most immediate past president of the American Medical Association. And she was the organization's first African-American woman to hold the position of president. She was the 174th president, and she has diverse experience as a private practicing clinician or physician, a county public health director, patient advocate, and medical society lobbyist. She currently spearheads the AMA's efforts to end the opioid epidemic, and has been chair of the AMA Opioid Task Force since its inception in 2014. Dr. Harris continues to lead the task force as it works across every state to eliminate barriers to treatment, provide patients with access to affordable, non-opioid pain care, and fight the stigma faced by those with substance use disorders. Dr. Harris grew up in Bluefield, West Virginia, and dreamt of entering medicine at a time when few women of color were encouraged to become physicians. She spent her formative years at West Virginia University, earning a BA in psychology, a master's in counseling psychology, and ultimately a medical degree. It was during this time that her passion for helping children emerged, and she completed her psychiatry residency and fellowships in child and adolescent psychiatry and forensic psychiatry at Atlanta's own Emory University School of Medicine. So she is plugged into this area and this community. Two themes that govern her professional life are passion to improve the lives of children and service to others. She's a recognized expert in children's mental health and childhood trauma, which is what she'll be speaking with us about today. Dr. Harris has led efforts on both local and national levels to integrate public health, behavioral health, and primary care services with supports for employment, housing, and education. Well, thank you, Dr. Harris, for being with us today, and we're excited to hear from you.
Well, thank you, Elise, and thank you for reading all of that. It's a wonderful introduction. Sometimes I listen to my bio and say, who is that person? But it has been my honor to serve the children and parents of our wonderful Metro Atlanta area, and I am thrilled, absolutely thrilled. I cannot tell you how happy I am to be able to participate today to begin the conversation, or actually participate in the conversation. I am absolutely certain that Odyssey has been talking about trauma and has been talking about equity and of course talks about mental health. And so I'm just glad to be a part of the conversation. And I have to say, I'm even more thrilled because my long time friend and colleague and confidant, Mr. Charles Relaford, now leads your organization. I knew of Odyssey before, again, as you know, since I've been here in the Atlanta area, but just was thrilled to see my long time friend take over the reins of your wonderful organization. So, Charles, great to see you, and thank you to all three of you for this opportunity. So, you know, we are in the midst of a COVID-19 epidemic, a pandemic, actually, one that we, of course, no one wished upon our country, indeed our world. But I believe there are plenty of learning opportunities in this COVID pandemic. Now, we have seen firsthand the disproportionate impact of COVID on communities of color. We have seen firsthand people talking about health equity and health disparities. And clearly, this is not a new conversation, right? Again, like I said, I'm sure Odyssey and many others in the community have been amplifying and thinking about and talking about health equity and the need to make sure that everyone has an equitable opportunity to achieve optimal health. That's how we define it at the American Medical Association. So again, not a new topic, but I do believe we are having new conversations. And that is what I, again, am happy to be a part of today. We also are having new conversations about mental health, not a new topic, particularly for Odyssey, for me as a child and adolescent psychiatrist, for many of those in the room. But unfortunately, it's a topic that has not always been difficult to talk about. I'll just hit some highlights. We know that unfortunately there still is stigma associated with even talking about mental health, right? And certainly even accessing care, and particularly in Black and Brown communities, because for so long, I believe many did not have accurate information and thought of mental disorders as a moral failing or a character flaw, or perhaps I just didn't pray hard enough, right? And so, again, not a new topic as we talk about mental health, but certainly new conversations, because again, the pandemic has elevated this topic. We are seeing survey after survey where there are increased reporting of symptoms such as anxiety and depressed mood, and even thoughts of suicide. And so as we have this new conversation, we have to have it, in my opinion, with an eye towards solutions. And that's what I'll talk about in a second. And the other, again, not a new topic, but a new conversation, is around trauma. As a child and adolescent psychiatrist, I see firsthand in my patients the impact of trauma. And we have fortunately witnessed over the last 5 years and conversation, enhanced, amplified conversation about adverse childhood experiences, right? And trauma, and how those affect not only mental health, but overall health. And I'm going to repeat that because I don't think a lot of people appreciate that. This study, a groundbreaking study by Kaiser, not the only study though, that links adverse childhood experiences, such as physical abuse, emotional abuse, certainly the divorce of a parent, or mental illness early on, link not only to symptoms, anxiety, depressed mood later, but also a link to cardiac disease, right? Other cardiovascular disease, diabetes, hypertension. And so that is a relatively new conversation, and one that I think we need to continue to have. Now, a point that I want to make is we, of course, can't in 30 minutes get to the depths we need to, but let's all make a commitment to do what I call getting beneath the headlines. You know, sometimes treatments come into vogue. I even say sometimes, unfortunately, diagnoses come into vogue. And all of us are talking about trauma-informed care. That is absolutely a good thing, but we have to dig deep. What does that mean? And how can institutions, organizations, individual clinicians operationalize trauma-informed care? And then how do we link all three of these topics, right? So equity, mental health, and trauma. I tell people, and Charles knows this, I am a rabid silo buster. We absolutely have to break down the silos as we have conversations, not only the three topics that I mentioned today, but also breaking down the silos between mental health and other aspects of healthcare. I just said, as we looked at the work around trauma, it not only affected later mental health, it also affected physical health. And by the way, I hate those two terms. I hate mental health and physical health. And someday somebody really smart is going to come up with a way that we can talk about these things in a way that doesn't separate them. But I know that in the lingo, in the language right now, it's mental health and physical health. So we'll start there. But I want somebody smart out there to figure out a way for us to stop talking about mental health and physical health, because they're all really integrated. And so speaking of integration, and Charles and I did a lot of work in Fulton County on integrating not only primary care, and of course for children it would be pediatric care with mental health care, but also all of the other services, that determine one's health, whether or not you live in a food desert, whether or not you have access to healthy fruits and vegetables, whether or not you have adequate transportation and housing, right? And education. All of those are the other determinants of health. And also, we need to, as we talk about equity, we need to have honest conversations about structural determinants of health. We have to be willing to talk about structural racism, right? And other issues around biases, both implicit and unconscious biases, and explicit biases. So, all conversations that really, I believe, weave together, again, in the spirit of silo busting, but taking silo busting a step forward and making those dense connections. And that's what we need to do now, make those dense connections between equity, right? Between mental health, between physical health, between those social determinants of health, and between trauma. Because we know that until and unless we do, we really won't see the improved patient outcomes that I believe we are all committed to. And we really need to start early. I might be biased. I'm a child and adolescent psychiatrist, but I believe we need to start in early childhood education. I'm so pleased, by the way, with this collaboration. Got to bring the parents in, got to bring the families in, got to bring the schools in. And so this is a great collaboration. So congratulations on that. It really is how we will improve the health of everyone and really make those dense connections. Now, I do just want to mention another issue around trauma that's topical. Certainly, with all that we are seeing regarding police brutality, witnessing that, the trauma of mothers and fathers talking about having conversations with their children, mostly Black and brown children, about jogging, even, right? And how you have to act when you're even walking in a park or bird watching or get stopped by the police. So again, another area related to equity, related to trauma, related to mental health. And I really try in all my presentations to weave all of these together and again, make those dense connections. And so what is the solution? Well, let's just say it. There is no one solution. There's not a one size fits all solution, but it is a commitment to building those dense connections, to building the connections, making the connections between mental health. And so we're talking about mainly children today. So pediatric care and child and adolescent mental health care, making those connections with school and school-based services. I have been a believer in school-based services actually since I came to Atlanta to train before school-based services were a thing. And thanks to all of those who continue to work, we need to continue to work to make sure. Just a quick aside, I believe, again, COVID has amplified the fact that, this is my personal opinion, we have really been counting on our schools to do too much. with not enough resources. Now, I believe in school-based services, but resources, money, dollars, funding, commitment has to flow to those services. So I think, again, as we saw when our children are out of school, they may not get that one nutritious meal that they would normally get, right? They may not get the mental health care that they might be able to get at school. Of course, schools and other educators and other school personnel are mandated reporters. And so school personnel have eyes on the children, right? 6, 8 hours a day and see things. And we're missing that, and that gets into trauma. So again, all of these things are so critical. They're woven together. And as we move forward, we need to think of health as we need to think of a system-based approach to health, right? And so we need to make sure that there are also upstream, midstream, and downstream opportunities to help. Upstream are those policies and practices. We need to look at our organizations. Do we have diverse boards? Do we have diverse staff? Do we have staff that is really trained in trauma-informed care, right? And not just because it's something we should all be doing, but really have a depth of understanding about that. We need to look at those food deserts. We need to look at our educational system. Again, I talked about the resources, the issues that have been laid bare with COVID. And we saw that one problem with remote learning is not having broadband access, right? And so again, these are all of the upstream policies that we need to make sure we take care of. And then we need to look at our communities and our neighborhoods. And finally, we need to look at our care and our serving organizations to make sure that we are trained, to make sure that we incorporate and integrate trauma-informed care into all of our services, and that we integrate our physical health, again, to use the term I don't even like, into our mental health care. And finally, that we require those who say that they are committed to mental health care to demonstrate that commitment by giving those of us in the world of serving those the resources that we need. So again, I wanted to stop and make sure we had a few minutes for questions. I know we have to end by 12:30, but I wanted to just amplify the need to make those dense connections and to look forward to a future of what a good systems approach to all of these issues would look like. So thank you again for this wonderful opportunity.
Thank you so much, Dr. Harris. We love the fact that you mentioned putting together physical health and mental health. That's something that we've definitely tried to help the community to understand as well, is that it's whole health. It is what is your whole health, and not separating the two, because they're both just as important as the other. So just like you would go to the doctor and you would check to see like, okay, what are my physical needs? But knowing that your mental needs also, like you said, affect your physical needs and vice versa. So definitely, what is your whole health? How are we working on whole health right now? And that's definitely what the collaborative is about working on just everything, how we can help the community all the way around. So thank you so much. Elise, do we have any questions?
Yes, so we've had a lot of people interacting, most people just kind of amplifying, Dr. Harris, what you've said, commenting on the fact that breaking down silos is such an important thing to do, and that, yes, that's a great way of identifying it, that we kind of get separated and siloed, and in some ways that's helpful in just understanding topics and what's going on, but in other ways it can be very detrimental to our community. And a lot of people applauding the idea of school-based services being important, but school shouldn't be the end-all be-all where all of these things are held. Our schools have become essentially community centers, and so when we have something like a global pandemic that comes through, and it basically alienates our community from those community centers in a lot of ways that I don't think we would have seen as clearly without the pandemic, kind of highlighting that for us. Some people have said, this is such an important conversation to have, that this is a direct quote, education has too much placed on them to address and fix many of the issues that impact children in the schools. So most everyone has basically just been amplifying and commenting that they support what you're saying and are understanding exactly where you're at with this. But some questions that I know that, as we've talked with you and as the mental health collaborative kind of team leads, I guess, we know that trauma is a word that we hear a lot about in the community, we know, and people have really taken to saying something's traumatic or they've been triggered. That's been a really common buzzword. What are you seeing as how trauma kind of shows up in the community, especially right now we're in an unprecedented time, right? But how do you see that, people are responding to trauma and interacting with trauma in your work?
Well, trauma is very individual, right? And so I think that is a key point to remember. Sometimes we want folks to fit into certain categories, and we think that if you have been traumatized, you're going to look a certain way, act a certain way, experience certain symptoms. But I think we have to recognize that trauma is very individual. And certainly the ultimate experiences one might have is a result of many things. Like, was it one incident of trauma? Is it continued? Is there been a mitigating impact? For instance, is there someone that the person traumatized could trust and go to, or did someone grow up in a trauma-filled, chaotic environment? So I think what we should start with as a given is that it's very individual, and that there is no one way that our patients will present to us with trauma, which means we have to ask the question, right? We have to be willing to, and not ask the question, what's wrong with you? And I know we don't ask that, but sometimes we think of, what are your symptoms you're having? What's wrong with you? And we should sort of think of the context of what happened to you? What has happened to you? Tell me about your life. Tell me about your experiences. We have to make sure we're asking questions in ways that don't re-traumatize, ways that trigger. And I am very excited, and I'm learning a lot more about narrative medicine. And I think as we move forward, narrative medicine, of course, I say narrative medicine because I'm a physician, but just narrative, appreciating someone's narratives. And it's not narrative, and it's not just a symptom checklist. What symptoms are you coming in today? But tell me about the context. I mean, we have to talk about those symptoms and get the reasons that people are coming in to see us. But we also have to give them opportunities to give the fuller picture, the fuller story, the fuller narrative. And I think when we begin to understand narratives better, then we can tailor our treatments. I'm on Twitter a lot, and there's so many terms that, and we've gotten better. Let me just say, as a nation, even as a profession of mental health professionals, we've gotten better. But I am very careful about the language that I use. And I was on Twitter, and someone said, and I agree with this, can we stop saying, so we tried to stop using non-compliant years ago, right? Think of what that means. I mean, listen, there already is a power dynamic with pay. I don't want to get into too much, but compliant means that somebody needs to comply. And so now, we use non-adherent. And so let's just think of that. We might put that in the notes. Patient, in our clinical notes, patient is non-adherent to meds. That is not enough. It should be, I'm just making something up here. A patient has been unable to take her meds because she cannot afford her meds, because she doesn't have insurance or lost her insurance, or the insurance doesn't pay for the medication, doctor, that you wanted, and the patient didn't have transportation to get back with you, didn't have broadband to get on our call. That's the narrative, right? So we really have to get beyond all of these, and really, when we're understanding trauma, know, again, two things: that trauma does not look like something, and that we really need to understand the broader narrative if we are going to address trauma.
Yeah, I think that's so important that the words that we use and the language we use to describe the experiences, not only of ourselves, but of others, is so important. We have a couple questions that have come up as you've been talking, which I knew would happen. Someone said, what would be some next steps or actions that parents slash mental health advocates, I think that's an important role of parents who are also mental health advocates, can take? This is important, and you're talking about the future and steps, policy wise, but what are some steps that parents and mental health advocates can take now?
So I would say that when accountability, let me just say that. The bottom line is accountability, and holds everyone who is responsible, or holds every stakeholder. They may not be responsible for your own individual care, but holds every stakeholder accountable for equitable care. And so advocates and parents should ask questions. What are your policies to ensure that I'm getting equitable care? Has your staff been trained on implicit biases? Is your board of directors diverse? Do they have an understanding about what is necessary to achieve optimal care? And then the other issue is a broader issue. Hold those officials, both appointed and elected, accountable for your needs. And this is nonpartisan, but the people that make laws and rules and regs, ask them the same questions. What is your commitment, and how have you demonstrated that commitment to achieve equitable care? What resources are you putting in? We need more resources. And I know that a lot of times people get frustrated with money and say, "Oh, you're just asking me to throw more funding." And let me just be clear, and the answer to that is yes, and it's unapologetically yes, because
Yes.
mental health has been so underfunded for several decades. So I think those of us in that area should be unapologetic and say, yes, we do need more resources. It's been underfunded. Now we are going to make sure there are good patient outcomes. We're going to make sure that we are offering evidence-based care. We are going to make sure that we are committed to equity, but you have to match our commitment.
Yes, so that's a great option. We got the questions flowing in real quick, and I want to make sure that we address some of them. So one was, many times children are impacted by the traumas of parents, not necessarily their own trauma individually. What are your suggestions to offer support to those children?
So the first thing is have parents really who are willing and get help if they need it, because that is certainly a huge issue. And of course, I think all of us probably on this call know that when we work with children, we are working with their entire families. In fact, that was one of the things that drew me to this work. Now, and I'm just, we have to make sure that we eliminate the barriers. And now I'm going to talk about a nuts and bolts thing like payers, right? Because if I am working with a family, but I identify in working with the mom or the dad or the guardian that there are issues there, I need to get them care as well. And we need to make sure in this country that everyone has access to affordable, meaningful coverage. Because, and again, this is my personal opinion, and we can be creative, but thinking about a way, if we are working with a child and we identify the parent, that there is some leeway to work with the parent, because we know if the parent has unidentified, unaddressed issues around trauma or anything else, that will impact the child. So we have a lot of regulatory barriers and payer barriers, and we're only going to pay for this and we're not going to pay for that. And we really, as advocates, both professionals and parents, need to make sure we are asking those who are setting these policies and these rules and regulations to really eliminate some of those barriers, because it then prevents us from offering the care that we need. So we need to make sure we advocate for parents to be able to address any unmet health needs that they have. That in turn will go a long way in making children healthier.
Yes, I think sometimes we talk about it, Tedra and I know Charles has too, about sometimes kids get referred more easily, and it's almost our foot into the door of the family and the parents of what's going on. It can build trust and community and a sense of engagement with them, with their child. A lot of times they open up themselves to address it, and we know that that's a lot of the work that we do as a family counselor agency here in South Fulton. That's a big goal of ours, is to make sure that we're seeing the whole family, that we're connecting with everybody who is involved. We have one more question on our time. I know we're right at 12:30, but I wanted to make sure we get this one in before we head out. Someone's asked, what strategies are you implementing to assist families to address the trauma being brought on by the pandemic? So I guess trauma specifically related to this time period. What do you suggest to implement with families?
Well, I think it's just making sure that as an organization, everyone is trained on language to use. Trauma-informed care. I mean, that is a good thing, and we need to make sure that we are trained for that, but also that we draw on a family's strengths. That we not only see their issues, but draw on their strengths, and also that we not, and this gets to blaming and shaming, I call it, but really an approach. Because not everyone, certainly choices, sometimes we get in the conversation about parents, individuals, children making bad choices. And I always say the choices you make are based on the choices you have. And so if your choices are limited, and let's just take it out of trauma for a second, if you don't have access to those healthy, fresh fruits and vegetables, you may, and you have limited resources, you may choose more densely packed, but perhaps non-nutritive foods that will fill us all up, but not offer that nutrition, again, that we need to be healthy. So I think, my recommendations are for organizations to review their own, organizations and individuals, review their own biases, review their own practices, and making sure that they are not only hiring people who have experience with this, and people of diverse backgrounds who have experience with this, but looking at their own internal policies around addressing unmet needs regarding trauma.
Yeah, thank you so much. I think it's such a intense time right now, and people are looking for any kind of strategy, any kind of implementation of a strategy that they can utilize, because there is just so much going on, and everywhere there's a new area that's popping up that is a struggle. It's been so many months since March, when we first in Atlanta, went into shelter in place, and we're kind of in this long-term stretch. It's been not a sprint, but a marathon, and we are not sure when this marathon will end, and if we'll ever go back to something that looked similar to what pre-March looked like.
Let me give some concrete tips, outside of, coming for help. The first is, all of us should give ourselves the grace and the space to not be okay, to identify whatever feelings we're having, and to not beat ourselves up for not being the perfect, educator when we're not, not doing our best at work, when we're juggling 5 or 6 things. For those who don't have the privilege of working from home, that are working really hard and may feel like they're not educating their kids or spending enough time with children, I just say, let's all give ourselves the grace and the space to feel whatever feelings we're having, to make sure we develop new routines for our children. It's not old routines, but new routines are helpful. That we sometimes turn off the news and the cable news, and I have to say that I have to tell myself that a lot. And also for children, because the news will repeatedly show a video, perhaps, and children sometimes, just like a 9/11, don't understand that it is a repeat of what happened, and they may think that it's happening again. We have to make sure we get enough physical activity, and that doesn't mean having a gym membership. And if you don't have a safe neighborhood to walk in, put on your favorite song and dance around your house, and make it a family, to get some exercise, and to try to eat as healthily as possible. But also allow yourselves those cheat snacks, that I call them, because they help out. So just wanted to leave with some of those very concrete. And I will say, for the parents who have young children, I've been very impressed with Sesame Street. But I know, again, that gets to access. But maybe those who have access, they are doing a good job, I think, of having conversations around some of these issues.
Thank you so much, Dr. Harris, for saying that for our community. I think a lot of our parents and the teachers, the educators, they do need to hear about giving themselves grace and letting themselves have time to experience the emotions that are going on, especially our parents, to the point to where they're not just saying everything's fine, it's okay, it's going to be
Right.
okay. And it's like, no, be honest with yourself, have grace with yourself, be honest with your children about, hey, this is a different time for us all. And not putting yourself down about not having all the answers. And that it is okay. So thank you so much for reiterating that to our community, to let them know that it is okay to experience those emotions. And it's okay to say, hey, right now I am not okay, but we're going to try to get through this.
Absolutely.
Thank you.
And
Well,
Dr. Harris, I appreciate you coming and being with us, and I know we're over time, but I didn't want to leave this on the table because you talked about some comorbidities with mental illness, and I don't want to downplay substance abuse because we know that right now there's an uptick in everything that's going on. So could you speak to that just for a moment before we close? Just how we need to protect ourselves.
Yes, and it gets to healthy coping, right? And so whatever you normally might use, for some people, it's prayer. For some people, it's meditation. For other people, it's yoga. For other people, it's music. So whatever you use to cope, continue to use that. Now, we've seen an uptick in folks who are maybe using substances, drinking more, using other substances to cope. And so we really do have to be mindful of what we are using to cope. Substances might be that, so we have to be mindful of any increase in use of alcohol, or or certainly any substances not illegal shouldn't be using, but sometimes it's just even drinking more. So we have to be mindful of that in this time and try to lean on our healthier coping mechanisms.
Yeah, thank you.
Thank you.
yes, thanks, Charles, for bringing that up. I think that's
Mhm.
important. Here at Odyssey Family Counseling Center,
And help if you need it, though. If you can't handle it
Yes.
alone, there's no shame in getting help.
yes, and at Odyssey Family Counseling Center, we do have a substance use program for individuals that includes individual and group support, as well as we have programs for the whole family and all ages. So starting at age 4 all the way up, we have a program for you or someone you know who might be struggling with something, or maybe just need some space to talk. Maybe you need a place that you can have some grace and space. And we would love to help you and be a part of that. As always, we welcome you. If you have any interest, I will put our information in the chat for you. You can click our link. Also, our website is a part of this page, odysseycounseling.org. We also want to thank our South Fulton Parents for Education group, who are active and a part of making the South Fulton Mental Health Collaborative available and allowing everyone to have access to these resources. This video will be up for you on our page. For as long as we have that page, it will stay up, so that if you know someone and you want to share this with them, to hear the really not only the amazing thought process and the energy and knowledge from Dr. Harris, but also some of those concrete examples that she's given us today, please share it with them, share it to your pages, and we welcome your feedback and interest. We also want to acknowledge that this is the last week that we've had our Wellness Wednesday series. We did 6 weeks of different Wellness Wednesday topics, and we might come back in the future and have those things. So if you are interested in that, please let us know. This is for you. This is for the community. We are just some of the facilitators who help make sure that we can call on Charles and ask him to ask Dr. Harrison and get us other people, Dr. Cunningham, who is here, and Dr. Green and Dr. Gima Whitaker from Fulton County Schools. So we bring you these people and help have these conversations so that your lives will be easier and that you can have access and have conversations about these topics. We really want to thank you so much for being a part of this. And again, thank you, Dr. Harris, for your valuable time.
Thank you so much.
You will always be a part of our community, and we welcome you back as often as you would love to be here, we want you to be a part of our collaborative.
Thank you.
All right, I'm gonna.
Any last words?
Yeah.
Dr. Harris, before we leave? Oh, Dr.
No,
Harris.
just thank you very much for being with us. Thank you, Patrice.
Thank you.
Thank you for this opportunity. Bye-bye.
Bye.